Welcome to Pharmtoberfest, which celebrates American Pharmacists Month. Today we are interviewing pharmacists who play different roles in the health of our communities. We have Dr. Tricia Brannon today, who is a critical care pharmacist. Thank you for joining us, Dr. Brannon. Why do you think it is important to celebrate American Pharmacists Month?
I think it's a great opportunity to celebrate American Pharmacists Month because it really allows us to educate not only other healthcare disciplines, but especially the public and the community on all the different roles that pharmacists play across many different healthcare settings.
As a critical care pharmacist in the ICU, what has it been like fighting on the front lines during this global pandemic?
You know, one of the most unique challenges that we really have been navigating through the COVID-19 pandemic is that, we're really having to all learn together in real time. We have emerging data, new therapies, even sometimes medication shortages that we've had to, really work together as a team to re-emphasize, how important it is to collaborate and work together while we're all learning how to navigate through this at the same time.
In your career as an ICU pharmacist, how are you able to help patients?
There are several ways that, as a critical care pharmacist that we help patients. First and probably the most important is that really working daily with the healthcare team, seeing these patients on our multidisciplinary rounds, where we're able to, see the patients and really take ownership all over the medication therapies and helping to make sure that patients are receiving the most optimal care. And then also working with patients and families to help educate them about why we're using these medications, what benefits they should see, what side effects they may anticipate, and really helping kind of meet them during this critical time to provide them the education that they need.
Thank you so much, Dr. Brannon.
Thank you.
Thank you so much, Dr. Brannon, for coming to speak about how you've helped combat COVID-19 in your role as a pharmacist. My name is Leanna Baker. I am the IPSF co-chair.
And my name is Mark, and I'm also an IPSF co-chair. And today we're going to talk about the effects of COVID-19 in America. So did you know that while COVID-19 has had a significant impact on our lives, it has also affected areas of lower socioeconomic status and people of color at a higher rate? And so this has also led to a higher rate of unemployment, since people are losing their jobs and aren't able to get employer sponsored insurance, and they're not able to see their primary care physician due to COVID-19 and those restrictions that they're taking in order to prevent the spread of the disease.
That's right. And restrictions in hospitals and inpatient settings have made it increasingly difficult for families to see their loved ones due to the visitation restrictions. Some families have not seen their loved ones since March, and people are passing away without seeing their families alone.
And another aspect that COVID-19 is taking a part of is drug shortages. So due to the disease, there's been an increased demand for certain medications. And with the increased demand, there's a lower supply, so many facilities aren't able to get the medications that they need in order to properly treat their patients, either with COVID or without COVID. An example of one of these medications is lidocaine, which is a numbing medication, and is also our secret word for this video.
Yes. Last but not least are healthcare workers. Healthcare workers have not only been affected by COVID-19, just like all of the rest of us, but they also have to worry about the spread in their jobs and bringing that home. It has led to longer work hours, increased demand, and less resources to work with. So we just want you guys to keep in mind the effects of COVID-19 that you might not see in your everyday life.
Yes, and so thank you so much for coming by, and I hope you wear a mask.